load up. Got it. Let me just share screen. Okay, so I know we're a little bit late, but we're just waiting for people to join us. So today we are going to have a talk on dealing with orthopedic management role questions. Now, this always was something we always put at the back of our mind, thinking, oh, it won't turn up, but there will invariably be a question along those lines, whether it is GERFT or something along those, or something else. It is there on the syllabus, so it is important to know about it, to practice for it. So Hani is going to give us a lovely talk about that today. I also just want to say as well, so I know we've had a few messages on the Telegram group about the YouTube channel. There was an issue which has now thankfully been resolved. So it is back up and running, and this talk will be up on it at as soon as we can edit it on. Okay. So hopefully at the end, any questions, if you could put them into the chat box so that we will pass those on to Hani, and we'll try and do some viable questions at the end. So without further ado, I will hand you over to Hani.
Thank you, David. Thank you very much. So, good evening, everyone. So today we are dealing with orthopedic management role questions for the FRCS. It is maybe this is a common actually scenario to come for the FRCS exams. It can come with a different way, either as like how to be involved in the management in your institutions, so it can give you like difficult like complications from your colleagues, or how to develop your unit, or for an example, I got this question in my exam, so how to develop the ED department in your institution, how to manage to do that. So first of all, why to be involved in the management of any hospital, it is important. So the healthcare systems that are serious about transforming themselves must harness the energy of their clinicians as organizational leaders. So you have to be a part of the management in your institution. You have to be a leader. And that is why, like, being involved in management courses or leadership courses, it's mandatory before finishing your training. So you have to be a leader, and you have to learn how to manage, and you have to get the skills to manage for the management role in your institution. Because any hospitals, there is a CEO which is dealing with the administration work, and there is a doctors, you are dealing with the patient, and both of you are separate from each other, and that is unfortunately it's not good, and we'll know why shortly. So there is a paper done in London and published in February 2008, and they found that the greatest clinician participation in the management scored about 50% higher on important drivers and performance than hospital with low level of clinical leadership did. So why the clinician is, you are not a healer, but you are a healer and leader and partner. And you have to remember that. So you are not only the doctor that treats the patient, but you have part of your job to be a leader and partner as well. So in any management, if you start to change anything in your institution, if you something wrong or something good, but you need it to be better, the most important thing here to be adaptive to change. So that's why, like Charles Darwin said, like the strongest species that survives, nor the most intelligent, but it is one that's the most adaptable to change. So here, how to change? What the steps to change of any organization, of any units, without blowing it up? So there is 3 techniques. The first of them, like it's called, and every name here is like a buzzword in the exam. Like there is 3 techniques that you can change with work discovery or better practice or test training. Like work discovery, instead of like looking for the complications, looking for complaints coming from the patients, you will investigate your institution, your unit, your department, and to see what's wrong. And you will find a lot of something. And how you can do that? We usually do an audit, like assessment of performance, like funnel plot curves and etc. The second technique, which is the better practice, and instead of simply adopting other organization best practice, screen the way work, like see what others do, and try to implement and generate new idea. So why not the new guidelines for anything? You should write it yourself. Why not? So, or even you can change or amend the guideline by yourself. That's part of your rule. The third is a test training. So instead of locking down of standard operating procedure, during training, experiment with others. So see what's others like trust doing for that. For an example, in your unit, you do like 2 or 3 joints a day in your elective ward, and there is another doing 4. Okay, and instead of stop working doing electives surgery in your unit or continue on that, but get in contact why you are doing 4 or 5 and we doing 2 or 3. What are we doing? How you can deal with that? What you do with the consultant and the theater staff to do more joints like than us? So that is why the test training, and it don't stop, but get the experience from the others and try to sort that out. Okay, so you found that is something in your units need to be changed, but it's always there is like restraining forces. There is a people will like don't like or will force any attempt of a change. So the driving force is coming from you. You want to make a change in your units, and there is others. They are happy with that. They don't see anything bad in the units. They think that it's running very well for years. Why are we going to change now? So you have to be like a state of of equilibrium between the 2 forces, like that. So you see something wrong, but the driver before you think like everything is fantastic. So no need for a change. So there is a steps for a change. The first step, just we have to create a sense of urgency. For an example, like this example of like the melting iceberg. So this like penguins start to say like we are in danger. No one listening to him. But once he create a sense of urgency, and once he said all of us will die because melting of the iceberg, so everyone listened to him. So there is a steps. The first one to change in anything, to develop any units, to create a sense of urgency. So for an example, in the ED, there is more complications. There is a waiting time for the patients to be seen by the doctor in the emergency department. Okay, that's not a complication, but a complaint. You can deal with that. You can improve the quality of the service if you are the manager or the leader of that unit. So the first step is to create a sense of urgency. We need to treat patients better. We need to decrease the waiting time for electives or whatever. Then you have to gather with the team. So you have to pull together the guiding team. You have to sit with the whole team and think about what we have and what we have to change, what we have to do, okay, as a team. Then, after that meeting, so you have to get a strategy or vision for a change. Then communicate for understanding what we need, what we'll do, what we're going to do. Then implement what we decided to do. Then produce a short-term wins, which is very important. For an example, we'll audit the next month to see how much patient we can do in the elective ward after implementing the new change or the new policy. Or we'll measure what is the waiting time in the emergency departments after implementing that change. So that is very important. So short-term wins, you have to decide that. So like an audit or performance assistance of performance in a short term. Then don't let up and create a new culture. So now you change it and you have a proof after auditing or assessing the performance that you change it to the better, and the service you give it to the patients is more better and more efficient than before. So here you can apply that on any scenario in the exam. For in my like example, like if you are the manager of the ED department and there is a complications more than usual, someone says that maybe it's more complications, or someone says that is the waiting time for the patients in the emergency department about 72 hours or 48 hours, which is more than expected, and we got a lot of complaints from the patients about that. What we are going to do? So that is the steps. So create a sense of urgency, then guide together, meet together, put a plan, and apply that plan and short-term wins, and then we'll create a new culture. And this is like the whole steps in more details, but I want you to start the answering any questions about any management rule about the target, because if you like, if there is no enough time, at least what is your aim? So I aim to develop a shared vision for a change that is clear, challenging, feasible, and universally appealing. So that is how to start your answering for any questions in the management with this sentence. So you have a complicated, how do you will develop your ED department? How you will change your elective center to be more effective? So my plan, my target, to develop a shared vision for a change that's clear, challenging, feasible, and universally appealing. That's very good starting sentence to start with. And this is like the 8 steps, which is it's recommended by Kotter, which is a Kotter's 8-stage process. You can say it in like 8 stage by 4. So like initiate a change by 2 things, like sense of urgency and creating the guiding coalition. So meeting with the teams and we'll making plan, then making a plan for a change, developing a vision, strategy, communicating the change vision, then implement change, then institutionalize your change. So apply that. So finally, what is the take-home message from that? So your role will be healer, leader, and partner. Don't forget that. The 3 techniques, which is a work discovery, a better practice, and test training. And please remember the Kotter 8-stage process for change and development. And also remember this, like my aim to change anything about shared vision of change is that clear, challenging, feasible, and universally appealing. And thank you.
brilliant. No, fantastic. Thank you very much, Hani. Do anyone has anyone got any questions they'd like to ask with regards to that?
I have a question. Hello?
Yes,
Yes,
go
go
Yes.
on, Abdullah.
Yes, sorry, I didn't know whether you were able to hear me. I have a question. Just to make it back to the exam, can you give us a couple of scenarios that can come in the exam, like a question that can come in the exam where we can answer it using the techniques you've described?
Okay, so we'll say there is a two divisions, like we are dealing with the complications or ethical scenarios. So don't mix between the ethical scenarios like drunk colleagues, like your colleagues doing HIPs with a high rate of infection. That's another thing. But I will give you more examples about how to management. For an example, how to transform your institution to major trauma center. Okay, it's very common questions in the FRCS. We start to be asking recently. Number two, that I got it in my exam. So you are a manager in the ED department. How to develop this department? How to develop that unit? So I didn't do that well, but I said about assess the performance, meeting with others, doing MDT meeting, audits, and funnel plots and all the things. It wasn't a great answer, but I think that is maybe the ideal. Another thing, how to decrease the waiting list for elective in your center. The waiting list in your primary hips and knees is 1.5 years, for an example. How to make that better. It's not all about the fund. So everyone maybe answer that question about funding. Okay, we'll build a new institutions, we'll recruit a lot of consultants, but that's not the way to answer that. He want to assess you as a leader, how to manage the things according to what you have. So it's not easy to give a fund for a lot of consultants. It's not an easy to build a new like theater rooms or anything. That's not an easy, but you can implement it to see why the waiting lists are high, how many hips and knees you are doing regularly for the last few months. Can we make it better? And after that, take advice from others. For an example, in my unit here, we found that if we doing 2 teams in electives, like 1 team, 1 surgeon, anesthetist, and theater staff like nurses and everything in the morning, doing the briefing in the morning, and finish by 1 o'clock. And the afternoon team will start at 12 o'clock, doing briefing at 12 o'clock, and they will start sharply at 1 o'clock. That we can do maybe 4 or 5 hips or 5 joints a day. That's an idea. How we knew that? So we asked another hospital what we do, why we doing like low numbers or low volumes of surgeries than others. So that's an example. So it's not all about complications and the root cause analysis and will stop him from doing surgery. This is another thing. You are not dealing with complications, but we need to improve the performance. You are doing good, but we need better.
That's often the case, unfortunately, with the NHS. You do as a unit, you can do very, very well, but you get asked to do more with the same. If not, sometimes it feels less.
Yeah.
It's a common thing that may occur. Now, are there any other questions? Yes. So I saw a comment in that. So Vilas, yes, if you could apply those same concepts if you're trying to change the consent form or consent form process within the trust, as Hani described. Kareem, you wanted to say something?
my apologies. I do apologize. I missed the beginning of Hani's excellent talk, but I'm aware of how good this talk is because I've seen it before. Various comments about how would you go about changing consent form. You have to be very careful about what that actually means. So if you're changing a consent form because the consent form is not meeting the standards, that's actually a quality improvement or an audit project, as opposed to as Hani's been describing, or my understanding of what Hani's been describing, which is a departmental improvement overall or departmental change, a vision to change. So careful in the exam if they're asking you, you discover that there's a problem with the consent form. It may be an audit question or maybe a quality improvement project as opposed to thing. But it's the same principles. Go to the standard of what you expect and measure to that standard and try and improve things along those lines. Does that make sense for us? I'm sorry if I'm misphrasing this for you.
No, that sounds a good plan. Yeah, thank you for that.
Yeah,
it's
very important. So yeah, generally when they're talking about consent forms, they're trying to get you onto the Montgomery versus Lanarkshire sort of process in terms of the change in terms of the consent process, how it's no longer a good body of doctors but a good body of patients. So it's very important to make a differentiation there. Yes, sorry. If let's say you're talking about how you do the consent form in terms of do you have a paper or electronic version, a lot of trusts seem to be moving from paper to electronic. That may be something that in terms of applying that principle, that's something you could use the principles that Hani described. Sorry, Kareem, you wanted to ask something.
Yes, I would just like to say, but can we make it simpler by saying that we are going to do a key performance indicator for the point of investigation? Then we will check where is our defects and compare it with the standards, or do a benchmark by searching other trusts, for example. Then we will do a QIP and improve this point instead of. I mean, this
well, that's sort of, you're talking more, where you're almost describing there is the clinical audit process. So in terms of, as Shwan said, what in terms of what service you're providing, how you improve it compared to the gold standard. So be careful about, this is more sort of management structures. So, I mean, I don't really want to, we'll discuss it a bit, but I've got a very good example of where you can utilize this as a Viva question, which we can go through a bit more detail in the next, when we finish the question and answer section. But yes, I see what you mean, but be careful. That sounds more like a quality, as again, quality control. So in terms of, so then you're talking about clinical audit, if you're talking about, for example, are you doing the right number of X-rays for someone who's had a broken wrist, let's say, for example. So again, we have gold standard, which is given to us by Boast, for example. Right, and then you have the whole, so they'll expect you to go through the whole clinical audit style process and governance picture in that situation, rather than a management style process. Okay, so I think there's someone else, one more question. Quality improvement there now. Okay.
Okay.
Right.
Stop recording.
Yeah, we'll stop recording. Before